Healing can be by first extension that repair of a clean surgical incisions, the epithelial regeneration predominant over fibrosis, and the narrow incisional space rapidly fill with bone. From 24 hours neutrophil basal cells migrate towards the clot and start exhibit and increase mitotic activity. 24 to 84 hours epithelial cells from the both edges. 3 days neutrophil replaced by macrophage. Granulation tissue, collagen, and epithelial covering layer. Day 5, granulation tissue fill the space. Collagen increase, mature epidermis to surface keratinized. Second week, continued collagen and fibroblast leukocyte edema. And the end of first month, scar continue with inflammatory cells convert or covered by normal epidermis. Tensile strength increase. The healing by second is intention when tissue loss more intensive inflammatory ulceration abscess. Regeneration of parenchymal cells alone cannot restore the original architecture. Extensive ingrowth of granulation tissue followed by accumulation of ECM, extracellular matrix, and scarring. Great necrotic debris exudate and fibrin must be removed, and much amount of granulation tissue to fill the gap with the result of its greater scar. This type of healing exhibits wound contraction and this to present myofibroblastic. Wound complications, first bleeding, escape of the blood from the blood vessels, and how to arrest the hemorrhage spontaneously hemostasis, secretion of adrenaline, blood vessel constriction, thrombocyte hemolysis, thrombokinase in presence of calcium convert prothrombin to thrombin, and temporary that to stop the hemorrhage temporarily by pressure by finger, or permanent like surgical like artery forceps or cauterization, or biological like silver nitrate. Shock. It is in dehydration, burns, hemorrhage, acute failure in circulation, severe hypotension, hypothermia in skin, and tachycardia. In shock, there is hypothermia in the skin and tachycardia. Anaphylactic shock with allergy to toxins or drugs, burn shocks, and dehydration. Hypovolemic with decrease of blood due to burn, diarrhea, vomiting, or dehydration. Vasogenic shock is acute blood loss. Electric shock, endotoxic shock, endotoxin like E. coli absorption in blood, severe hypotension. Treatment cover fluid, blood transfusion, antihistamine. Drug for heart or blood activation, atropine, adrenaline. Abscess, another complication, accumulation of pus in space due to death of cells because of pyogenic bacterial infection, like Corynebacterium pyogenes. Types, diffuse or focal. The diffuse one, no capsule, and focal capsulated. Treatment, sure maturation, help by catamol ointment. Surgical incisions, wash by H2O2 or potassium permanganate fluid drainage, but gases if needed. Hematoma, it is rupture of blood vessel and then accumulation of blood subcutaneous in the tissue. Ulcer is wound in the skin or mucous membrane has no ability to heal. Causes chronic irritation, foreign body or dead tissue in the wound, blood supply constraining, some diseases like TB or cancers. Treatment, remove the cause, remove dead tissue, remove ulcer surgically, and so antibiotics. Sinus and fistula. Sinus is a purulent canal, and fistula it is infected pus between the cavity and canal, or canal and body surface, or two cavities or two canals. Causes poor drainage, accumulation of pus in the wound, foreign bodies, diseases, TB or cancer. The sign presence of opening wall covered by granulation tissue. If new or hard and covered by fiber if old. Gangrene is this and putrefaction of tissue or organs in a live body. Causes mechanical time, constraining of blood supply, indirect change in some tissue like food deficiency, accompanied some diseases like heart, blood vessel, nerve, respiratory system. The types of gangrene, dry gangrene and moist gangrene. The dry is mummification of tissue, dryness and smallest of tissue, size, and there is no tissue loss. The moist in tissue rich with fluid, liquefaction of tissue due to petrification of bacteria, accumulation of fluid. Toxins can be absorbed by circulation septicemia. Treatment, remove the cause, surgical for fluid remove, amputation. The emboli is the foreign substance within the blood vessel. Rheumatic fever because of the absorption of toxins. Syncope, it is sudden temporary brain failure due to sudden cardiac arrest. Tetanus, also another complication, and it is a fatal disease caused by neurotoxin Clostridium from Clostridium tetani, the bacteria, with convulsions in skeletal muscles. Pathogenesis, the bacterial spores enter through punctured wound and under anaerobic multiply and proliferate. Toxin production in blood symptoms. Incubation period, few days, 4 months. Symptoms, neck and limb rigidity, neck tetany, membrane or protrusion of eyelid, and statutory muscle spasm, and rhizotonicus, is lip screwing. Treatment, anti-tetanus serum, vitamins, fluid.